If you're planning to apply for medicine or dentistry this year, there's probably one acronym that keeps you up at night. UCAT, UCAT. The University Clinical Aptitude Test is the gatekeeper to your career. It's not about how much biology you know. It's all about how your brain handles pressure, logic, ethics. But there's a big news here, which is in this coming cycle, there's a difference. Abstract reasoning, just like the year gone, is gone. That's not coming back. So don't worry about that. Timings have also shifted and the stakes are higher than ever. So let's talk numbers. In the new UCAT cycle, it is a 2-hour marathon, 2 hours. So it's not a race, it is a marathon, and it's very important that you prepare in that way. Of course, there is no more abstract reasoning, and that means you have 4 sections to contend with, and by the very virtue of getting rid of abstract, they have expanded the other sections. So what are the other sections? Verbal reasoning, decision making, quantitative reasoning, and situational judgment. I'm not going to go down to individual sections, how many questions and how long, because as you'll understand, year on year, numbers and times can change slightly. For that, what I would refer you to is UCAT's own website. Look at that prior to beginning your UCAT preparation in that particular year, and you'll see the exact numbers, times, and number of questions. Sufficient to say that in terms of numbers, verbal reasoning, decision making, and quantitative reasoning, these are the sections that are marked. So you will get a mark out of 900 for each section. And it's very important to hit the top deciles. You need to try and get as many marks as possible, and I'm thinking around about the 800 per section mark. Situational judgment, that hasn't changed in the sense that it's banded. And most universities in the UK will only interview you if you have band 1 and band 2. Most universities won't consider you for band 3 or lower, but do have a look at the individual universities. And again, once you've done your UCAT, depending on what your score is, what your banding is, by all means contact bluepeanut.com, contact us, and we will help you and guide you into what university options you have. So let's deep dive a bit, if that's okay. Let's look at each section and see how can we perform well. So generally speaking, in verbal reasoning, what I tell my students to do is don't read the whole text. Scan. Use the scan method, look at keywords, and the question in the first place. You've got about 30 seconds per question. There's no time for deep literary analysis. In the decision-making section, use your whiteboard. So each student is given a whiteboard. Draw Venn diagrams, draw things, look at it. Look at logical drawings, straight and chains. Make sure you can see what you're doing. If it's a syllogism type question, like a tongue twister, sketch it out. Map it out, like spider diagram or something like that. I find that's quite helpful. Of course, I go into more kind of deeper analysis and strategies in my course, in my live course, in my online course. By all means, come along and have a look. In the quantitative reasoning section, and I would argue that's probably your worst enemy, there is an on-screen calculator to help you. It's a bit clunky. It reminds me of the old days when I was at school many years ago. Now, if you can do mental arithmetic, you're at an advantage. If you can do maths in your head, you're ahead, all right, literally, because it's quicker. But by all means, use the whiteboard provided, all right? And I would say use the calculator for complex multi-step sums or just to check if you have time. And then SJT section, the situational judgment section, what do you do here? Well, it's not about just doing what feels right, okay? It's very important. And this is just one of those sections where you can prepare well. In fact, you can prepare well for all sections, but I'm telling you now, with situational judgment, it's important to have prior understanding, if you like, prioritization, or ability to kind of decipher medical situations. So read the GMC's Good Medical Practice Guidelines. You read GDC statements. And the same if you're, a vet or something like that. By all means, look at the Royal College, look at the medical college, look at the dental college, and look at the guidances that they have, such as good medical practice. UCAT wants to see that you can prioritize patients and people safely, manage situations safely. You're good at team communication above your own ego, if you like. In terms of dates, as you can understand, it can vary year to year. Generally speaking, Pearson VUE, the hosts for the exams, they'll publish the dates so that you can book them in the month of May. And I generally say that you can sit the test right up until kind of end of September-ish. And in my humble opinion, I think you should begin your revision as soon as you've done year 12 exams and you've had about a week's rest. That then allows you between 8, 10, perhaps even 12 weeks revision prior to sitting your test towards the end of August. Some of you kind of write to me or contact me and say, well, I'm going on holiday, family holidays, this and that. Well, see if you can incorporate revision whilst you're on holiday. See if you can sit the test perhaps a couple of weeks later, all right, so that you can come back from holiday and give yourself maximum chance in getting a good result. Generally speaking, for revision, I say 8 to 10 weeks. Minimum, in my opinion, is 6 weeks. Remember, it's not a sprint, it's a marathon. And in the same way, the revision for it, the preparation for it, is just like that. It's a marathon. You cannot cram. It's not a quantitative type exam. It's behavioral, psychological, how you understand and process. So this takes time to train the brain. And so you need to give yourself a number of weeks. You need to think about kind of strategies so that you're effective in each section. And this is something I teach in my courses, and I can delve deeper into it if you come and join us. And in terms of like resources out there, by all means have a look at the UCAT Consortium website. But also there are very good sources out there. Not least, if you look at the Blue Peanut website, we've published loads of vlogs, loads of blogs as well, articles to help guide you. And also there's an online course that you can access. Listen, the UCAT is a beast, all right, but it's bearable. And evidence points to that from my previous experience. Our students have scored very highly, consistently in the past years. It's a test of stamina, not how quickly you can do the race. It's a test of strategy, all right, as much as your intelligence, all right? And I think you've got this, all right? If you think this has been useful, do have a look at our channels, subscribe to our Instagram, TikTok, Facebook page so that you can stay up to date with every time I publish something. Good luck.